Hey guys, Woodruff here reporting to you from a Texas ice storm. So, as a warning, I'm recording this during the fun now, it seems like yearly February ice storm in Texas where we all shut down. So, I am at home working, and it is possible that I could have a loud interruption from my fun 5-year-old. So just know that that might happen, and it's unavoidable, but we will see. Let's see what we can get through. So this is my long lecture for diabetes. I'm going to break it up into different pieces. Even though diabetes is one topic, I'm going to break it down into different sections. So this first section is going to be over introduction to diabetes, the difference between type 1 and type 2 diabetes, and some of those symptoms or what diabetes looks like. So we're going to start with that. All right. So what is diabetes? So most people are familiar with diabetes. This is probably, if you had to learn any disorder in school, one of the most important ones you learn, because it's probably going to be one of the most common ones that you ever see in practice. It's very rare to go throughout your life as a nurse without coming in touch with diabetes in some way, shape, or form. Even if you're in labor and delivery, there's glucose issues. Babies and children can have diabetes or sugar issues, etc. So this is something you're going to see for most people, no matter where you're at, unless you're dealing with very young, healthy, like outpatient surgeries. Well, even that, I would think that there's some people with diabetes. So I'm going to just say yes, most people are going to come in touch with diabetes in their life. So it's really important to know, because diabetes is not just about, hey, I have this problem, managing my sugar. It's a chronic disease. So again, it can get better, but it's something that has to be managed really closely, and it affects the whole body, because effectively diabetes affects anywhere that you have blood vessels. And if you think about this, where are your blood vessels? Well, they're everywhere. So it can cause a lot of problems. The issue here is that either the patient is not producing insulin at all, like their pancreas is not making enough insulin to support their cellular needs. And we'll talk about the role that what do you call it, insulin, sorry, I should say insulin, sorry, I do want to say insulin, the role that insulin plays in energy and stuff like that, and glucose. But we're either not making enough, and insulin is so important for a lot of cellular processes, or I have insulin, but the cells have stopped responding to insulin the way that they used to. So I no longer can get um I no longer can get glucose into the cell. I was just reading my language there. I was like, did I write that right? Yeah, it sounds right. Diabetes is the seventh leading cause of death, and maybe from not necessarily directly, like, the diabetes itself, but it's usually complications from the diabetes, whether acute or chronic. There is some different, theories and stuff about diabetes. There are some genetic links. Especially for type 1, they're seen as like an autoimmune potential component. And then there's also some environmental factors that we look at with diabetes. So let's talk about what the big deal is with diabetes. So the big deal is that insulin is like a key, and it's a key that helps to get glucose, which is your energy source, into the cell. So effectively, everyone, or at least I should say everyone, I used to think before I came to nursing school, or I really should say until I started teaching this, because I don't think I understood half of what I learned in nursing school when I learned it. You don't learn until you have to teach it seems, but I'm like truly like learning on a cell level. What's going on here is so what I used to think is that if glucose was in my blood, that's how I got my energy. But where I actually need glucose, which is my energy source, is in my cell. And the only way it can get in the cell, it can't get in by itself. What it has to have insulin. So insulin literally opens the door to the cell, and then glucose can get in. So if I don't have insulin, kind of backing up to what I said before, if I don't have insulin, or if I have insulin, but the cells aren't opening when it's trying to open the cell, if the insulin is unable to open it, and this is what we call insulin resistance, then I'm not, either way, the end problem there is that I cannot get glucose into my cell, and that's my energy source. And then what also I have, if all of my glucose is stuck in my bloodstream and it can't get into my cell, either because I don't have any insulin or because my insulin is my cells are resistant to allowing insulin to work. What happens is I have a whole lot of sugar in my blood, and sugar in my blood irritates my blood vessels, it dehydrates my cells, and my body cannot function because it does not have the energy it needs. So effectively what I end up having here is I have a whole bunch of sugar, like, kind of imagine it. Oh, this is a good analogy right now with our Texas snowstorm. So kind of see it like this. Is right now, all of the post offices, Amazon stores and stuff, they're full of supplies, and stuff like that, where they have plenty of available resources. But here's the thing, is that right now with the snowstorm, there's no one to safely deliver them. So either they have, kind of like with that not having insulin, that either we have no one to bring the supplies out for delivery, or even if we do have some people that are willing to risk their lives and try to deliver packages and other stuff or deliver mail, the other issue that we have is that people don't want to open their doors because it's too dang cold. So yeah, maybe look at it that way. And if that analogy doesn't help you, just ignore me, because I'm a little bit of a dork. But anyway, so the big issue here is that energy cannot get into the cells where it's needed, and then also sugar ends up, or my energy sugar ends up stuck in my bloodstream, which causes irritation. It causes dehydration, and what happens here with the dehydration is effectively, the way that water and stuff moves, the diffusion, osmosis, and stuff like that, it always wants to go where there's more particles. So if my cells are here and my bloodstream's here, and in my bloodstream are all these extra glucose particles, there's just a whole bunch of sugar, my cells are going to be like, man, like all the water is going to be like, man, I want to be over here where the party is, where there's all this glucose. So it starts, so all my water from my cell, it literally leaches water from my cell, and starts to one, try to dilute all that extra sugar. But again, water follows usually where there's a lot of particles. So if there's a lot of particles in my bloodstream, all my cells get leached of all of their fluid, and so then I end up dehydrated. So I have irritated blood vessels, dehydration, and then I'm incredibly tired, fatigued, and weak because I don't have the energy that I need. So hopefully that makes sense. So, like I mentioned, when glucose gets in the bloodstream, it leads to a lot of problems. You have anywhere there's a blood vessel, there's a problem, which is everywhere. So you have a higher risk, and we're going to talk about all of these, but these are some of the big ones: cardiovascular disease, infection, blindness or eye problems, what we call retinopathy, and kidney disease as well. And this all has to do with either nerves getting broken down, which leads to issues, or the blood vessels themselves getting broken down, which can lead to inflammation and other problems. Or an inability to get, like for infection, it's like I can't get my immune defenses, like my white blood cells, where they need to be, because of the breakdown of the blood vessels and breakdown of the nerves. So, and kidney disease as well, which is what we call diabetic nephropathy, but we're going to talk more about those later. So it's lots of perfusion problems, and again, anywhere there's a blood vessel, there can be a problem. So let's start doing some, I know you guys love these extra questions, starting to get some practice for your fun exams that are coming up. So let's look at this first one. It said, this is a select all that apply for who needs to be screened. It says, which statements, which means there's more than one, from a client would warrant a nurse to perform additional assessments or request testing from the physician related to a concern for diabetes? So in other words, which of these would point me to thinking someone is at risk for diabetes? So this is a select all that applies. So remember, with these, we start at the top, we work our way down. They're a true, false. We don't say, hey, it has to be at least this many, not this many. We're just going straight down. So the first statement from a client says, my sister has a diagnosis of diabetes type 1. So this is really saying, is a risk factor for diabetes genetic, or is it like something you can inherit? And I believe we already talked about this, that yes, it is something that can be inherited. So I'm going to say yes for A, because we would just want to get further testing to see if they're at risk or possibly have diabetes. The second one, I walk a few miles 3 to 4 times per week. Well, with this one sounds like a pretty healthy option. It seems like this is something that they what do you call it, this the walking a few, keeping like active in movement. I think that's actually a good way to combat diabetes or to decrease your risk, because I think that like physical inactivity is one of the risk factors. So I'm going to say no for this one. C, I have a very stressful lifestyle and struggle with anxiety. Well, this doesn't seem like a positive thing, but I don't know if this is directly related to diabetes. Like, I don't know if just a high stress lifestyle or anxiety itself is a risk factor for diabetes. I mean, stressful lifestyle is a risk factor for a lot of things, but I usually think more like cardiovascular stuff. And I know that some people are going to say, isn't cardiovascular and diabetes really linked? But um, this is looking more like, I wouldn't sit there and what do you call it? If I had a patient and they were like, oh, I have a really stressful lifestyle, I wouldn't be like, talk to the doctor, hey, we need to screen for diabetes. They're really stressed out and anxious. Like, I don't see the direct connection there. So I'm going to say no to C. All right, D, my blood pressure usually is around 140/80. Well, that's high. And kind of going back to what I was just saying, I think there's a connection between if you have cardiovascular disease, things like hypertension, hyperlipidemia, that you're going to be more at risk for diabetes. So I'm going to say yes for D. So far I have A and D. Last one, I'm 55 years old and used to smoke when I was younger. Well, smoking is definitely not good. I know anything that irritates the blood vessels could be an issue, but I think just because they're older, I feel like there's a certain age that everyone needs to start getting screened for diabetes. So I'm going to say yes for E based on the age. So I think A, D, and E are our correct answers. Now let's look more into risk factors, or who should be screened. Is really what this is a different question. Risk factors is one thing, but who should be screened is like who could possibly get diabetes is everyone over 45. People that have an increased body mass index greater than 25, so anyone overweight, obese. If I have a first degree relative with diabetes, sedentary lifestyle, like I mentioned, there's certain ethnicities that are going to be more at risk, especially Hispanic, Native Americans, African Americans, Asian Americans, and Pacific Islanders. Women that have had problems in pregnancy, either having a very large infant that's considered greater than 9 pounds, or those that had gestational hypertension. I'm going to look for signs of insulin resistance. We're going to talk about acanthosis nigricans later, but it's like a darkened rash that can be found on the neck. It can be found in the armpits, anywhere in the folds. That's just a sign of insulin resistance or being obese. People that have polycystic ovarian syndrome are going to be higher risk for diabetes because of hormone imbalances that they have related to the PCOS. And again, people with cardiovascular risk factors, so those with hypertension or high cholesterol. It's also important to know before we talk about the different types of diabetes is to talk about pre-diabetes. So pre-diabetes is something that doctors are looking more and more at. Effectively, it's people that are having difficulty managing their glucose or with their insulin response. So they may not, like, they may be close to a diagnosis, but they don't have enough of a poor response to actually fully get a diagnosis. Like, their numbers are not quite there. Usually these people do not have symptoms of diabetes. They're not, walking around having the same things that we're going to talk about soon that are hallmark for diabetes, but they can still be getting the effects. So this is a big thing. We'll especially talk about it with type 2 diabetes, is many times, like, people with type 2 diabetes, they don't even know that they have it. Like, there's no symptoms, but yet all that sugar in their blood is causing them to have complications or problems, like their organs, their blood vessels are being affected before they're even officially diagnosed. So don't think like no symptoms, no problems, because just because you don't have symptoms doesn't mean that your body's not feeling the effects of all that sugar. So people with pre-diabetes can prevent diabetes, or they can delay a diagnosis of diabetes. Once you have diabetes, you cannot get rid of it as a whole. So that's why with pre-diabetes, we want to really get ahead and try to prevent or delay any sort of diagnosis of diabetes. And so these people are going to need regular screenings and also lifestyle changes to really start to see a difference. Sorry, so let's break down type 1 and type 2 diabetes. And I want to really make something clear before you get too overwhelmed. We're not, at least at where I teach, we're not going to have a question that's like, how do you tell the difference between type 1 and type 2? Because there's really fun, like, I mean, there's big differences, yes, between them, but more so it'd be really hard to write a test question around that. The most important thing that you want to know is this thing at the bottom, that when you think type 1 and knowing the difference between type 1 and type 2, knowing that the only thing that can fix a type 1 diabetic is going to be insulin. And we're going to talk about why here in a second. But it's kind of knowing those little things versus, like, we can't give you a scenario where a person, like, here's kind of the setup. Like, we could tell you little things like, hey, you know, people with type 1, usually they're younger, they, you know, might be, you know, have weight loss, or, you know, be more of a slim stature, where people with type 2 are more obese, but we can't say for certain. You know, there's little fine differences, but, you know, it's definitely important to know, what do you call it, if it's type 1 or type 2, but just know that we're not going to be like anal retentively trying to give you a scenario and have you try to figure out, is it type 1 or type 2? Because yeah, I mean, at the end of the day, a lot of the treatment is the same. We look at their how they're doing and how what their needs are, and you know, meet those. And we're going to talk about the treatments and stuff here soon. But anyway, so for type 1 diabetes, only, you know, about 5 or 10% of people that have diabetes have this type. It's a lot less common. This is a pancreas problem. So this is where I was talking about, where there is literally not enough insulin to supply the body and get those, you know, keys, those insulin, sorry, I should say, get that glucose into the cell. So think of this again, like, you know, if you have an Amazon store, but you don't have enough drivers, like, you can have all the supply, what do you call it, of glucose all day long, but if you don't actually have drivers to go drop it off at the right place, it's not very helpful. So it can be genetic. There's an autoimmune and viral component. Like, a lot of people that have type 1 diabetes, what happens first is that they have some sort of virus. And after they have that virus, a lot of times type 1 diabetes shows up. You see this happen. They'll usually have like a respiratory infection viral thing. And then all of a sudden, you know, they start going into crisis and they have diabetes. It's usually very abrupt for type 1 versus type 2. It's more gradual over time. But again, the problem here, there's little or no insulin, which means there's too much sugar and there's no keys to get that glucose into the cell. So they're going to need insulin the rest of their life. This is also sometimes called insulin dependent diabetes. And that's because when it comes to these patients, is that there's not anything else that can help them, because if the problem is that we don't have the insulin, there's nothing that can replace that aside from insulin. Like, that's a necessity. So again, you know, like, just like the Amazon store, you know, analogy, if we have a whole bunch of supplies in the store, there's no drivers, we can't get it to where it needs to be delivered, and there's nothing that can replace those drivers. We need someone to deliver those materials. So what do they complain about and what would we assess? So you're going to see that this is pretty similar for type 1 and type 2. The only thing I would say is type 1 may more often present with these, what we call classic symptoms. The classic symptoms are the 3 Ps, and that's, you know, these are all signs of high blood glucose. It's polyuria, polydipsia, and polyphagia. So let's go back to that cell situation that I was telling you about. If I have a whole bunch of sugar here in my bloodstream, and here's my cell, remember, all the fluid from my cell is going to go and want to hang out with all the sugar in the bloodstream. And so as a result of that, they're going to feel thirsty because their cells are dehydrated, and they're going to start to get dehydrated. On top of that, if a bunch of fluid moves from my cells into my bloodstream and starts diluting all these particles, and when I have excess sugar in my blood, anytime there's too much of something, your body wants to get rid of it. Too much fluid, too much particles, so your kidneys start to get rid of it. And also your kidneys start to, like, try to get rid of the excess. I'm going to just stop with that before I get too complicated. So what happens then is you're peeing a lot. So I have all this dehydration because my fluid is moving from my cells into my bloodstream, and then my body is trying to flush it out. And I'm also what was I going to say? Thirsty because I'm losing all my fluid through my urine because I'm peeing. They also have polyphagia because despite the fact that I have all the sugar in my blood, the sugar is not where it's supposed to be. And so my cells are hungry and they're saying, feed me. So I'm hungry because I don't have glucose where I need it. I'm thirsty because all of the glucose in my bloodstream has leached that water out of my cells and flushed it out. And I'm peeing a lot because I have all these excess particles that my body's trying to get rid of, and all this extra fluid that my body's pulling from the cells because of the excess sugar, and then dumping it out through my kidneys. Um, like I mentioned, the patient may feel tired, or they might have trouble healing or getting sick because they don't have the same immune defenses, and they can start to have some blood vessel issues. Like I said, pretty quickly, and they're tired because of course they don't have the energy source they need. Especially with type 1 diabetes, they might complain of weight loss, or we might even look for some complications, like they could have vision problems, vision loss, or even some neuropathies, which is numbness and tingling. We'll talk more about that later. So then what's the difference with type 2? So type 2, this is what majority of people have. So when you have a patient that when you're getting reported a patient, the nurse says they have diabetes, 9 times out of 10, it's type 2 diabetes. So this can be a pancreas problem, just like type 1. Eventually, what happens with type 2 is that a lot of times their pancreas does not make enough insulin, or they get to the point where they do have to be insulin dependent as well. But for many people with type 2 diabetes, this is also a cell problem. This is what we're talking about with the insulin resistance. So imagine, what do you call it? What was I going to say? If your body's constantly using insulin, maybe because you're taking in a lot of sugar, or it's overworked effectively. The cells eventually are going to be like, hey, I am not opening the door to insulin anymore. It is too much. I'm tired of opening the door for insulin. I'm tired of managing all this glucose. So they just kind of shut down. So in other words, even I can have plenty of insulin as a type 2 diabetic, but if my cells will not open up for the glucose, the insulin is it doesn't matter. It's a moot point, because there's nothing that the insulin can do if it cannot get the glucose into the cell, no matter how much insulin you have. This has more of a what do you call it, a gradual onset, where it's usually something a little bit more insidious, where a lot of times these people show up and they have a complication first. So in other words, like they might have an infection that won't heal, like it's some sort of infection that won't heal, or they can commonly have like maybe even a complication, like one of the blood vessel complications. We'll talk about more about those later. I don't want to get too deep into those, but their first appearance in the emergency room might be that they're experiencing a complication versus, hey, something hasn't been feeling right. There's a genetic link and some environmental factors, but the biggest thing is usually there's a close tie between obesity and type 2 diabetes. Compared to type 1 diabetes, the thing that's different here too is that type 2 diabetics can actually, just from lifestyle changes, potentially not even need to take medications to fix their diabetes, depending, not many or everybody, but some people can just make lifestyle changes. Some people just need oral medications to manage their diabetes, type 2, and some people need insulin. Now, some people need all three. Generally, we're not going to just give people medications. Everyone needs lifestyle modifications for the most part. But some people might only need lifestyle modifications. Some people might need lifestyle and oral. Some people might need lifestyle and insulin. Some people may need, again, all three. So you're going to see the same symptoms here when it comes to type 2 diabetes. They're going to maybe complain of I should say the one difference here is they may complain of no symptoms. Again, where they just come in and it's just like, I don't know what's going on, but I have this wound that won't heal or something like that. They can have the classic symptoms, like we talked about, a lot of the same stuff. But again, the one thing you want to look for that's a little different here is look for complications, because a lot of times this is how they're going to present with a vision problem, with the neuropathies. They usually have some sort of systemic complications or systemic problem first, because they still have insulin, so their body doesn't have, it doesn't go to some of the same extremes that type 1 diabetics do that have zero insulin. So usually usually these just present with a lot of the blood vessel complications from too much sugar in the blood. All right, that is actually going to be it, because the next video is going to talk about diagnosis and numbers and stuff like that. So we're going to stop here for this first part of the diabetes lecture. I have other simpler lectures and stuff like that too, if it's helpful. But anyway, I'll see you for the next one.